We have built a technology base and a service model that applies the power of financial incentives to any care management program, and we deliver radically higher adoption and adherence rates. Hello, everyone. My name is Matt Swanson, co-founder and CEO of Reciprocity Health. We launched our commercial product TheraPay in late 2022 and expect to close 2023 north of $3 million in contracted ARR. We have an open $3 million seed round and welcome conversations with health plans and health systems serving Medicaid and Medicare. Prior to founding Reciprocity Health, I spent 10 years leading CMS-funded payment reform, and I was also part of the early stage teams at both CityBlock and Eleanor Health. All of this work, at its core, hinged upon a single issue: patient engagement. Lack of engagement, non-adherence to care programs, especially within Medicaid and Medicare, impacts virtually every point on the care continuum. And it is not a small problem. Hundreds of billions of dollars of avoidable cost are attributed to non-adherence each year within Medicaid alone, affecting HEDIS, STARS, and other quality measures. But more importantly, we really need to look at this from the patient's perspective, because for us, this is fundamentally a health equity issue. It disproportionately affects the most vulnerable populations. Low adherence is not driven by people stubbornly refusing to take their medicine. It is driven by the number of people who are too overwhelmed, too confused, too intimidated to take those first steps towards their care. So what is to be done? Well, CMS figured it out years ago. Paying financial incentives directly to patients radically changes adoption and adherence to care programs. CMS even field tested it in Medicaid programs across 10 states. The results published in 2017 showed that the prospect of financial reward draws people towards their care, and the confidence, trust, and momentum gained as rewards are earned keeps them coming back. But unfortunately, this research did not lead to commercialization. The market, payers and providers alike, saw the work as too complicated, beyond their core expertise, and beyond their administrative capacity. And this was the impasse that Reciprocity Health was built to solve. We have built a technology base and a service model that applies the power of financial incentives to any care management program, and we deliver radically higher adoption and adherence rates. The issue of capacity is solved by building our business as a tech-enabled service, where we become a specialized extension to our clients' existing engagement strategy, avoiding the need for complex technology integration. The issue of complexity is solved through our proprietary care platform, the TheraPay consumer-facing app, and the ability to leverage behavioral data. At the heart of our model is the care platform, which allows our managed service team to efficiently design, launch, and manage financial incentive programs at any scale. What is designed on the care platform is launched through the TheraPay app with mass personalization that provides members a roadmap, encouragement, and real-time rewards for closing care gaps or completing steps on a condition-specific journey. Our work generates a unique and proprietary data set on patient behavior relative to their clinical care, opening an enormous opportunity to leverage AI, and we have built out our data architecture and infrastructure accordingly. And our results have been significant. In our first year working with a large Medicaid MCO with over 150,000 members, we modeled and then delivered significant ROI and savings, delivered 10 times the monthly enrollment rate than the prior vendor, more than doubled critical HEDIS measures, increased primary care visits by nearly 60%, and decreased member grievances by 95%. And while ROI is critical, other factors matter as well. Reward opportunity allows us to improve member demographic data and contact information. We've seen 90% of our Medicaid members change the phone or email on file. With 12 different programs currently running across 6 states, our care platform and the TheraPay app are delivering customized white label reward programs for both targeted and full patient populations. Our clients regard the ability to apply the power of financial incentives in ways that were previously impossible as a game-changing opportunity. And we see the real impact as we deliver hundreds of thousands of dollars to our members as they take these proactive steps towards better health. Thank you.
Great presentation. People have been working in the reward space a long time. We've heard a lot about the potential of rewards. You're specifically applying it in the world of social determinants of health. Can you share a little bit more about that strategy?
Sure. Very early on, we recognized that we were in a really unique opportunity where we could get two levels of utility out of every reward dollar. So the prospect of a reward dollar changes a behavior. But then once that reward dollar is earned, there's actually an opportunity for us to allow our members to spend those dollars in ways that address their social determinants of health. So through partnerships that we've set up, we can have those reward dollars being spent on our therapy card towards transportation, solving access to care, or prescription delivery, or food as medicine, as you're going to hear from Epicure later. Those are opportunities that we can really have people self-invest in their own care. One of our current programs, a client really prioritized financial stability in the household. So within the app, we were able to set up a partnership with a local community bank that specializes in onboarding the unbanked with wraparound services. And with one click from our app, members are able to pre-fill a application for a free savings account and become a member of that community bank. So there's just a real opportunity if we can take those dollars that are earned on this health journey and then have those applied towards social determinants. And that's part of our consistent programming.
So one of the things that we hear a lot about today, right, is adherence. And it seems like one of the things you're really effective in doing in driving behavior change is having adherence to care plans. And we all know how complex healthcare is. How have you been able to affect this behavior change within that complexity?
Yeah, so the complex care journeys are where we really shine. So we recognized early that it isn't just the reward dollar that matters. All of our programming follows three tenets: clarification, motivation, and facilitation. So the clarification comes from our team breaking down a care curriculum into a gamified environment so the app can very clearly show what the next steps are. Motivation comes from the reward design, which has many different aspects that we can compile. And then facilitation is helping people close that intention to action gap so that you're really within the app able to do so many things. Like if it's an HRA survey, you can fill it out right there on the app, submit it, and get rewarded immediately. If it's watching a diabetes management video, you watch it right there on the app and are rewarded immediately and notified that those dollars are arriving on your card. We also allow people offline to get help finding a nearby LabCorp and get a map and directions and a phone number to set up that appointment. So we've really tried to hit all aspects of this. It isn't just about the financial reward. It's all about the outreach and engagement, communication, nudging, reminders, but then also helping people along the journey on the way.
So in your presentation and kind of the next logical evolution of what you just said, just to double click on it for a second, was I saw a lot of data and you're using that data to help affect the behaviors. Can you talk about, is AI a factor in your business? And if so, are you integrating it? How are you working with it?
Yeah, absolutely. There are so many aspects of AI for our business. We do collect a lot of data that is specific to the behaviors of members relative to their journey. And so we can take that data and really optimize program design and really get an approach of hyper segmentation, realizing where people are getting hung up and what extra messaging people might need in a particular subcohort. So we can apply it there. We can apply AI and especially the more recent advances in LLM to help our members get better support in their programming. And we have huge efficiency gains for our design team on how we apply those nudges and consumer engagement. And then there's another aspect of our work is so complex that the reporting out and the participation of our clients is sometimes a barrier. And so much of AI can actually help our clients drill down on real-time dashboards or help with input into our systems. So those are all areas, four realms in which we really see AI applying to the efficiency and impact of the business.